I think there's a lot of medical students and a lot of nursing students and a lot of others, people who, in their young adult life, they say, I want to make a difference. The challenge is by the time you finish your traditional training, that's kind of beaten out of you. You build up barriers, you build up walls to protect yourself through this training process. I really desire to show students and resident physicians that this is an actual career you can do. And you can actually be the kind of physician or nurse practitioner that you fantasized about when you were a teenager or a young adult. I really love teaching.
As far as how I feel about this place, incredible. Dr. Stefan has a very cool approach in how to handle the patients here. So when a patient comes in with a disease, it's about aggressive preventative care. How can we make it so they don't have to come back to the doctor anymore? Some of these patients don't speak any English. Some of these patients, a lot of these patients, have never been to a clinic before, and it's for the uninsured. So some of these people have never really consistently seen a doctor. So their primary healthcare education is here. People will come here for a spectrum of care. You can see a woman that is preparing for pregnancy, throughout pregnancy, right before labor, and then she can come in here with her newborn, and then you can raise her newborn. So it's like a total continuity of care here. But if somebody has a healthcare clinic that they trust, they're going to continuously see the doctor and they're going to make sure they're healthy. The physicians here grant students a lot of autonomy and a lot of trust. And you get to know that you're working in service and you're making a real difference is something I'm addicted to already.
If there were two words I would use regarding Wesley, it would be caring and competence. And clearly the caring is irrelevant if there's no competence. And here, what I'm getting is caring in addition to competence. At no time has he ever seemed rushed. I mean, he's really, really genuinely interested in my well-being. And I always leave here feeling better than when I arrived.
So in private practice, insurance companies have pretty much decided you should be able to do everything in like 15 to 20 minutes, which is when you have a diabetic whose husband just died and they start crying. I mean, try doing that in 15 minutes, you know. It's impossible. So I've never been a rush physician, and I've never been a one thing only. Health centers are so rewarding as far as like non-monetary. You know, it's rewarding in such a different way. It's just amazing. We've been able to get so much equipment and expand to really serve our population because we had standing room only. And
I'm using my background in medicine and also my love of teaching, and I like to teach. This is the perfect job for me. They understand better when I say, you see, this is a patient that doesn't have any diabetes. And when I show them this, oh, is that happening to me, inside me, in my blood? Yes, and that's why you have problems with your eyes. The idea is to initiate a conversation with the patients. While they're waiting for the doctors, to the doctor, they can grab this and start looking. This is about family planning. It's all about family planning. It's bilingual. They feel confident, they can come, they trust me, they can talk to me. When you go to some place and you don't know the language, and you find somebody who is from the same country and speak the same language, it's like feeling like home.
Yo estoy muy contenta con los doctores acá y con las muchachas también. Sí, atienden muy bien, el doctor me atiende muy bien. Si tengo preguntas, responde todas mis preguntas muy bien. Las muchachas siempre son muy amables y cuando llamas por teléfono te explican todo por teléfono también, o sea, te dan muy buena atención. Cuando iba a otras clínicas, a veces el doctor no hablaba español, pero no tenía personal, solo había una persona y si ella no estaba no podía. Es buen precio, sí, es muy accesible. Cuando hay unas personas por fuera, conocidas mías, que no tienen aseguranza y que batallan para el médico, yo digo que vengan acá, porque es un buen servicio. Me gusta aquí.
And once I walk in the room and they see me and they see that I speak Spanish, then like they open up, they feel more comfortable, and I guess that makes me feel good, I guess, to be helpful in that way. We have a lot of Hispanic a lot of Japanese, Chinese, Vietnamese people that come here. Black, white, all kinds of people that come here.
Yeah.
They're all different accents, different places they come from, different way of speaking.
We're all here because we want to be here. We're all here because we love it, and it's kind of like working together for a similar cause.